Let's begin with a rapid revision of the three main chapters, that is cystodes, trematodes and nematodes. In cystodes, actually in all three of them, I've got you tables so that your faster learning curve is there and at the same time better retention, you have things at one place. So before I start with these set of cystodes that I have, I first want you to know the differences between their head end, because the adult worm questions have definitely started coming up more. So when we talk about the cystodes and we talk about their head, you will realize all of them have 1, 2, 3, 4. All of them, front and back, if you look, they all have 4 suckers, and those 4 suckers are basically for attachment. Which is the one that does not have a sucker, and that is Diphyllobothrium latum. If I write its full name, it is going to be Diphyllobothrium. Guys, that basically tells me latum, that tells me di means two, and phyllo means leaf. So this is like something which is going to have a leaf-like configuration. Yes, I can see that. And di means two what? Two bothria. Bothria means mouth. It has two grooves. It doesn't have suckers. It doesn't have suckers. It has two suctorial grooves or bothria. It has no suckers. So remember, question number 1. All the cystodes have suckers on their head end, but Diphyllobothrium latum has two suctorial grooves. Question 1. Question 2. Wherever the suckers were there, these suckers are also going to have hooklets like this. So all of them have hooklets. However, all the Tata things are not going to have, they're going to do Tata to the hooklet. So which are the ones that are not going to have any hooklets? So Taenia saginata, Tata to the hooklets, no hooklets. Diminuta, again, no hooklets are going to be there. And Diphyllobothrium lata, again, no hooklets. So simple, wherever you get ta, you are going to do Tata to the hooklets. Rest all the other ones, as you can see. So if I ask you, does Taenia solium have hooklets? Yes, Taenia solium has 2 rows of hooklets. Next, if I ask you that does Echinococcus have hooklets? Of course, you will say, ma'am, it has 2 rows of hooklets. Does H. nana have hooklets? Yes, but what's the difference? It has a single row of hooklets. Please remember, H. nana is your life lesson that I had taught you. It has a single row of hooklets. Also, please note, this is the only cystode which is going to have a single host. So God has given H. nana everything such limited capacity. Only one row of hooklets has been given, only one host has been given. And what is the size? Come on, tell me the size of H. nana. So it is also the smallest. You call it the dwarf tapeworm. It is referred to as the dwarf tapeworm. So remember, H. nana has been given the least importance in this entire feature. One host, one hooklet, smallest size. But H. nana then decided, that is what I'll tell you guys, have very limited resources but shine very, very bright, because H. nana decided that I am now going to come across as the most common cystode infection that you have. You can call me dwarf, you can give me a single hooklet, you can give me a single host, but I am going to shine very bright. So yes, in this entire thing, 2 take-home messages. Number 1, all of them have suckers. The only one with grooves is going to be Diphyllobothrium latum. All of them have hooklets, but all the Tata ones, Saginata, Diminuta, Lata, they are doing Tata to the hooklets. And the ones who have a hooklet have 2 rows except for H. nana, because H. nana has everything limited, 1 row. Now let's come to the host. So please note, the definitive host for all of them is going to be man. The only one which does not have a definitive host of man is Echinococcus, because Echinococcus ka dusra naam is dog tapeworm. So the definitive host is going to be dog. Even the intermediate host is going to be sheep. So basically humans ka to kahan possibility aayega? Humans or man is basically going to be an accidental host. Human or man is going to be an accidental host over here, accidental and also dead end. So humans ka basically a life cycle in which human is thrown on one side as an accidental host. That is what a Echinococcus is. Baki sabka, the definitive host is man. Now let's come to intermediate host. What did I tell you? H. nana, God gave H. nana very limited things. God has not given it any other host, only one host, and that is going to be the human. So remember, this is the one that has a single host only. Or what are the others? So what is H? Diminuta? Diminuta is not H. nana. Only nana was nano, chota and single. Diminuta says along with humans, there is also going to be rat. So that is why, what do you call it? You call it the rat tapeworm. That is the other name for it. Now we come to Taenia solium and saginata. For one of them, the intermediate host is pig, and for the other, it's going to be cattle. So please note that solium and saginata mein who has the T? Saginata has the T. So it is going to be cattle for saginata, and for solium it's going to be pig. I hope you remember both of them are going to cause intestinal involvement. Intestine involvement दोनों में होगा, but for Taenia solium, if you remember, I'm going to tell you in a while, solium सब कुछ कराता है. So which is the one that is going to cause neurocysticercosis? Neurocysticercosis is going to be by solium. Fine. Now we come to Diphyllobothrium latum, because this is different. This is the only one that has 3 hosts. From today onwards, you are going to call it Diphyssobothrium latum. What is this Diphyssobothrium? What is the meaning of calling it Diphyssobothrium? Because human being to samajh mein aaya, ma'am, was there, but there are 2 chota fish also there. Please remember, this contains another intermediate host called Cyclops and another intermediate host called fish. So how many intermediate hosts does it have? 2. So remember, Cyclops is chota wala fish and fish is bada wala fish. So this is going to have 2 fish. So from today onwards, I'm going to call it Diphyssobothrium latum. So if you get a life cycle between a human being and a chota fish and a bada fish, and that is D latum. And please remember, this has been associated with a very famous anemia. This is going to be associated with B12 deficiency. So that basically means that it is associated with megaloblastic anemia. Now what I'll do before I abhi ye sare human wale, let us take them up jaldi se quickly in 5 minutes. Let's look at their life cycle, and then in the end I will come to this echinococcus where human is not the main host. So let me start off. Before I go into their details, do you want to see their eggs as well? Yes. Now please remember all the cystodes. What does cystodes remind you of? Cis reminds me of 6. So yes, all the cystodes are going to have something 6 in them. So they have a hexacanth embryo. They are going to have a hexacanth embryo. Let me zoom in and show you. Can you see 1, 2, 3, 4, 5, 6? The egg. The egg has 6 hooklets. So there is a 6 hooklet wala embryo, 6 hooklet wala egg that is going to be present. What else? I can see over here that there is a membrane on the outside which is known as the outer membrane, and then there is one on the inside which is known as the inner membrane. So दोनों के बीच में क्या है ma'am? You can see some dot dirty material. So that dirty material is known as the yolk granules. These are known as the yolk granules, and then you can see 2 knobs. We all can see one knob here and one knob here. What are those known as? Those are known as the polar knobs, or you can say filaments coming out of it. Those are known as polar knob or filament. तो क्या क्या parts है जल्दी से? It has 6 hooklets in the center, outer membrane, inner membrane, dot dirty yolk granules, and then it has these polar knobs. All the cystodes have this. तो exception भी तो होगा. Yes, look at this egg. This egg over here, म्यूल से मैम same ही तो लग रहा है. This also has the 6 hooklets. वो वाला concept है. Outer membrane भी है, inner membrane भी है, but that dirty material has gone missing. There are no yolk granules that I see over here, and there are no वो जो 2 knobs थे ma'am, they have also gone missing. So this means there are no polar projections, there are no polar knobs. This is the egg of H. diminuta, that rat tapeworm. Rat tapeworm says all, like H. nana says I will follow this, Taenia solium will follow this, Taenia saginata will follow this, but H. diminuta says I want to be different. Rat wala, that is not going to have those yolk granules, that is not going to have the polar knobs. What is this egg over here? The egg which has a lid. Can we all appreciate? A cap hai on the top, right? This egg is referred to as an operculated egg. That is how you will identify it in the paper. Operculated egg is the egg which has a lid present. So lid is like a protection, and we need protection against what? We all need protection against STDs. So protection wala egg is going to be seen in STDs, which means which cystode? There is a cystode which you don't study, but you just need to know the egg, and that is Spirometra. There's a cystode that we are reading right now, Diphyllobothrium latum. So Diphyllobothrium latum में सब कुछ ही अलग चला ma'am from the first slide. In the first slide you told me that the structure was like a leaf, very different, no suckers, no hooklets, nothing of that sorts. In the second diagram you told me that this is the only one which is having 3 hosts, chota fish, bada fish, 3 hosts. Now you're telling me this is the one that is going to have an altogether different egg with a lid also. And what is the T? That's the next chapter. The trematodes except schistosoma. The trematodes except schistosoma are going to have the operculated eggs. So these are the different eggs that you're going to find. So let me quickly ask you from here. H. nana has what egg? Usual 6 hooklets wala egg, but H. diminuta has that difference. It will not show you the yolk granules and the polar knobs. Baki D. latum goes into STD mnemonic. It is operculated. Taenia solium saginata usual wala egg. Echinococcus granulosus ye bhi usual chalega. ठीक है. Now let me ask you if you could guess something. What can you guess? Always when you have to pick up a life cycle, look at the hosts, guys. I can see there is a host over over here which is human being. Then I can see a chota wala fish made over here which is cyclops, and that chota wala fish is being consumed by a big fish. So I see that there are two fish and there is human being. If there is a human and there is a chota fish which is cyclops and there is a big fish, what is your answer over here? This is a case of Diphysiobothrium. From today onwards, I'll call it Diphysiobothrium only. It is a case of Diphysiobothrium latum. Which anemia did I tell you? It is associated with B12 deficiency, that is megaloblastic anemia. And now they would be asking you what? They would be asking you which is the form, like when we eat this fish, obviously the big wala fish is going to be eaten by us. Which form do we eat? So if they ask you what is the infective, and this is a very, very famous question. What is the infective form? It is the L3 larva known as plerocercoid larva. The plerocercoid larva is the L3 larva which is going to be eaten up by humans when they consume the fish, right? What is the treatment that we have? The treatment is going to be by praziquantel. The treatment is by praziquantel. Moving on, going to the next one. Now starting off with the next life cycle, let's see if you guys can pick it up. What do we have? I told you pick up the host over here. So first and foremost, I have a human being. Next, I have what? I can see a pig over here. I can see a cattle over here. Okay, pig and cattle. I've got both the cycles in one place. Pig hota, I would have been talking about Taenia solium. Cattle hai, so I'm talking about Taenia saginata. So this is very, very simple to pick up now. What I need to know next over here, just in case you say, ma'am, I could not pick up from the host, you will start looking at the head end. In the head end, if you see that there are suckers with hooklets, to wo solium hoga. Whereas saginata will only have suckers. Will it have hooklets? No, it has done tata to the hooklets. It will not show you. So that is also a big hint that you get in the paper. If you're not able to pick up the family only, ma'am, I could not understand cystode, nematode, trematode only I couldn't understand. Zoom into the eggs. If you start seeing eggs with 1, 2, 3, 4, 5, 6 hooklets, 6 toads wala egg hai ye, cystode family, then you start thinking of cystode family table. There are multiple hints that are present in a life cycle. First you start with hosts, then you look at the worms and the eggs, and I can guarantee you will be able to crack it. Okay, now I'm going to show you a table which I've taught you in your main course, and you know that time also I said don't run away. Now also I'm saying don't run away because your table nahi yaad karna. You don't have to learn it the way you are thinking you have to learn it. You have to learn it the way I am going to make you learn it, and that is how to differentiate Taenia saginata from Taenia solium. So you don't have to go into numbers. Don't go into numbers. Learn less more. Keep your life very simple. Zyada kam, utna yaad karna hai. Okay? So Taenia saginata is the lengthy name. Taenia solium is the chota wala naam. So now, if I ask you which worm is going to be lengthier, saginata has more length. If I ask you that which is going to have a bigger head, the bigger scolex, it is going to be saginata. If I ask you who has the longer neck, saginata. Who has more number of proglottids, saginata. Who has the greater measurement of the gravid segment, saginata. Who is going to have more number of uterus lateral branches, that is also saginata. Who has a vagina, again saginata. And who is going to have more follicles in the testes, again saginata. So no matter whatever the examiner will ask you in terms of number thing, number, zadas come. So saginata has more everything in number. The only thing that it has done tata to, the only thing that it has done tata to are the hooklets. The scolex is not gonna have any hooklets, but that is the only tata that it has done. So in terms of number, saginata is more. But when it comes to the disease aspect, solium is going to be the sole cause for all the diseases in the body. So now let's ask you that first tell me that what are the two forms that every organism has? One is a larva and one is the egg. तो पहले तो larva का नाम बताओ, because larva is something that is going to come into us and cause infection. So saginata was to do with cattle ना, तो cattle मतलब कुछ bovine cattle, तो that is why larva has been named Cysticercus bovis. Whereas Taenia solium, sir वाला sound, so Cysticercus cellulose is the name for the larva. And now tell me Taenia saginata का larva, where is it present? It's going to be present in the cow. It is not going to be present in the man. Whereas Taenia solium, it is sab kuch. I have always told you, see, Taenia solium is sab kuch. It is present where? The larva is present in the pig also. The larva is present in the humans also, right? Now we come to the egg form. Is the egg of Taenia saginata infective to us? No, the egg is never infective. Larva is always infective. But solium says, nahi, mera sab kuch. My egg is also infective to man, and that is the reason that when solium, both of them had decided that we will cause intestinal problem. Solium said, no, my egg is also infective. I will cause sab kuch. I will also cause cysticercosis. For example, I will cause neurocysticercosis. So overall, you realize, first learn their names. What are their names? Taenia saginata was cattle, so it is Cysticercus bovis, and Solium is cellulose. Now, if I ask you which is the larva present in animal and in human, Solium, sab kuch. Animal may be, human may be. Which of them has an egg which is infective to the human? Again, Solium, sab kuch. Which is the one which will cause intestine problem and brain problem? Solium. So you realize कि number game में saginata won and disease game में Solium has won. And what is this neurocysticercosis that you have to know, guys? What is the most common site involved in the body? Brain parenchyma is involved, and the patient presents most commonly with seizures. Again, treatment of both, as you all know, is gonna be praziquantel. There is no doubt about it. But there is a pathology correlation that I want to do over here before I proceed, and that pathology correlation is this. If they give you this kind of a tube, which is ऐसा all zigzag, pathology slide है ना, pink and blue वाला, and if you zoom in a little carefully, actually you will see there is a head end. There is a scolex, and if you see these lighter things, those are hooklets. No one will make you identify this. I'm just giving you an orientation because yahi do photos hai internet pe. These are the photos that you're gonna get. So embed it as it is into your memory. That okay, this is the head end, and you're seeing some aisa zigzag, ma'am, aisa tube jaisa convoluted. This is what they are talking about. Cysticercosis. That is going to be a hint in pathology that you have. I hope everyone's okay. So these are also done. Kya kya pad liya? Done with the Diphyllobothrium latum, Taenia solium, Taenia saginata. Now let's go on to the nana and the diminuta. Let's talk about them. So if I show you a life cycle like this, for example, nothing very weird. You'll say, ma'am, if it was going on only in human being, bas human being chalta, I would have easily identified it. Human being matlab it is H nana, only humans. But if they end up giving me chota sa rat in between, then I'll make it up as an H diminuta, and then I'm going to call it a rat tapeworm. It is going to be rat and human both, and I'll call it a rat tapeworm. Nothing more that I have to teach you, because do you guys know what is their structure, what are their eggs and everything? Baki sab pata hai. And you know H nana was that person who had limited resources, but is the most common. So he has single row of hooklets, he has a single host, he has chota wala, he is the dwarf tapeworm, but he has the most common incidence. So H nana mein kuch different nahi hai. Now finally I come down to the last one, and that is known as Echinococcus granulosus, because here man is not given any importance. This is going to go on between the dog and the sheep. So whenever I see a life cycle like this, which is going on number one between the dog, which is the definitive host, and a sheep, which is an intermediate host, I know I'm talking about Echinococcus, whereas human beings basically tend to be the dead end or the accidental host, right? Now this is known as a case of Echinococcus granulosus. What is the disease that it causes? It causes the famous hydatid cyst. This is how a hydatid cyst looks like, guys. You can see these pearly white cysts that are present. That is a hydatid cyst. What is the most common site? It's going to be the liver, and the second most common site is going to be the lungs. But kya hota hai? What exactly is that hydatid cyst? It is going to have three layers. It has three layers that are present. Number one layer on the extreme outside is going to be the pericyst. Pehle name yaad kar lo. Pericyst, then we have ectocyst, and then we have endocyst. Okay, peri, ecto and endo. Do you want to see their features? Perfect. Let's go ahead with it. Look at this diagram. The first layer on the outside that you have is going to be the pericyst. Let me tell you, pericyst is the only cyst which is host derived. Means the parasite has not made this layer. I have made this layer. This is something made up of inflammatory cells. This is what it is made up of, inflammatory cells. So I have contributed to it. The second one that we have over here, this pink color layer, this is known as the ectocyst. And ectocyst has a, please mark it, this is the most famous question. Ectocyst is something which is going to have a paintbrush appearance. It is looking like a paintbrush. Can you see? It appears as if someone took a pink color brush and has just painted this area like a stroke. So paintbrush appearance. So kya ho gaya? Pericyst. I'll make a human being over here. We have contributed to pericyst. Ectocyst kaisa hai? Ectocyst is like a paintbrush appearance. And endocyst, ma'am, finally where all the organisms will be made. So if you ask me, where is the endocyst? I will say, acha, this is where the hooklets and the organism and the scolex, sab kuch banega. So can I say germinal layer? This is the germinal part from which everything is going to generate, and you can see these different organisms being made. इनका नाम क्या होता है? You are not going to call them organisms. कुछ ऐसा fancy नाम बताओ. So what are these referred to as? These are known as the brood capsules. These new organisms are known as brood capsules, and can you all see their hooklets over here? All of them are going to show you hooklets. I hope you remember from your general microbiology that the hooklets of hydatid are going to be Zn stain positive. So repeating once again, there are three layers: pericyst, which we have made, ectocyst, which looks like a paintbrush, and endocyst is where all the new organisms will form. What are the new organisms known as? New organisms are known as the brood capsule. What are they going to contain? They are going to contain hooklets. Hooklets are positive for what? They are positive for Zn stain. Okay, now finally, if I ask you that what are the other tests that you should be doing before I go to that, there is a difference which you need to know. Echinococcus granulosus to pad liya. There is also something known as Echinococcus multilocularis. The difference is that multilocularis looks like this. It looks like multiple locules. सिर्फ देखने में, like for example, Echinococcus granulosus was looking like one cyst. Multilocularis is going to look like multiple cysts, and this starts looking like the alveolus. अगर alveolus का structure देखो physiology anatomy में, so this is how the alveolus looks like. So that is why Echinococcus multilocularis is known as alveolar hydatid cyst. That does not mean ये alveoli में होता है. That doesn't mean this is commonly seen in lungs. Again, if you ask me the most common site, I will again say liver, and the lungs will still be the second most common site. Exactly how you had in hydatid. Liver was most common, lungs was second most common. यहाँ भी same है. Liver is most common, lungs is second most common. The only reason I'm calling it alveolar is the structure looks like multiple locules. Finally, you will tell me how are the the treatment and what are the things you have to, what are the tests that you do. So now every bullet that I'm going to tell you is 1 point PYQ. Ultrasound imaging पे क्या दिखता है? Water lily sign. Next, there is a new test that we have nowadays called ARC5 immunoelectrophoresis. All PYQ, that is done for hydatid. There was a skin test which was done earlier, Cassoni test. अब नहीं करते. Which hypersensitivity is it? Cassoni test is type 1 hypersensitivity. Now no one does it. And will you ever do FNSC? Never ever. FNSC is contraindicated. Why? Because this is going to result in anaphylaxis. Please note. Imaging में quickly, water lily. ARC5 immunoelectrophoresis is a testing, new test for hydatid. Cassoni test is not done. FNSC is not done. Else Cassoni karoge, FNSC karoge, patient is only going to die off. How do you do the treatment? We do the treatment by a modality called PAIR. Now what is PAIR going to be? So I'll quickly give you a recap over here. So for example, ये hydatid है, ठीक है? I'll explain it first. ये hydatid है, तो you'll take a needle, you'll puncture it. You'll say, oh my God, ma'am, you'll puncture it over here, तो all the fluid will come out. Patient को anaphylaxis हो जाएगा. Exactly, नहीं कराना. Puncture करो, and then you take out all the fluid. So what are the things that you're going to do in PAIR, guys? Number one, when you're concentrating on PAIR, please do puncture of the cyst. After you've punctured, quickly aspirate all the fluid out of it. Quickly aspirate all the fluid out of it, and then you have to kill the organism na, तो एक injection दो. You have to give an injection of say a 95% ethanol or any kind of alcohol. Why? Because that is said to be a scolicidal agent. That is something that will kill the organism. So injection दो alcohol का. After the organism is killed, remove that also. So now what you're going to do with R? Reaspirate. So simple. First you are going to puncture the cyst, remove all the fluid, inject some alcohol, and then again remove all the fluid, and that is what you know as the PAIR. So I hope you all know what PAIR stands for. Puncture, aspirate, injection, reaspirate. This makes you finish off the entire cystodes chapter. Hi everyone, having discussed the cystodes, let us do a quick 10 to 15 minute review of the trematodes or the flukes. These are a set of the trematodes that we have, and under this you have to know first what are their names and what are their hosts. So I'll start with the host first. Remember, schistosoma is someone who's always obsessed with S and is going to act very different from the rest of the family. So firstly, talking about the definitive host in all of them is going to be the human being itself. So man is going to be the definitive host, but it's only for fasciola. See, fasciola has that she sound coming into it. The other name for fasciola is sheep, and hepatica tells me liver. So fasciola is said to be the sheep liver fluke. And that is why the definitive host in this case sometimes can be the sheep also. Sometimes other than humans, it can be the sheep as well. But for everyone else, it is only the humans. Then what is the first intermediate host? For everyone, the first intermediate host is going to be snail, right? For each one of them. So if I see a life cycle of human and snail, at least this much I know that the family is always going to be the trematodes. So how will I differentiate between them? Based on the second intermediate host. Now schistosoma is obsessed with S, and schistosoma has got its S. It has got the snail, and now it does not need anything else in life. So it doesn't have a second intermediate host. Talking about Paragonymous, para sounds like cara. So everything related to cara is going to come up over here. This means if they say crab or they say crayfish, these cara words are going to be the second intermediate host for Paragonymous. Clonorchis opisthochis, this will remind you. So for example, from today onwards, instead of writing it Clonorchis, you can write it Clonorfish. Because for both of these, the second intermediate host, Clonorfish, opisthochis, for both of them, the second intermediate host is going to be the fish, right? Now let's move further. Let's talk about Fasciola hepatica, FA, and Fasciolopsis buscae. Both these FA things are going to be fresh aquatic vegetation. Both of them are going to stand for fresh aquatic vegetation, that is FA. So their second intermediate hosts are done. They could definitive subka human, first intermediate is snail for all, and our second intermediate host schistosoma does not need any. Para is going to be cara, crab, crayfish. Clonorchis, opisthochis are all fish. Fasciola, Fasciolopsis, they are all fresh aquatic vegetations. I'll come down to their names in a while. Let me go into what are their infective forms, modes and everything. So remember, again over here, schistosoma is going to be obsessed with the alphabet S. So if I ask you that what is going to be the infective form for schistosoma, you will say it is going to be the Cercaria larva. The Cercaria larva has a very classical identification. It is the one that is going to have this forked tail. This forked appearance is going to be the Cercaria larva. And for everything else, guys, for all the others, so if you ask me what about the rest of the family, it is for everything else going to be the Metacercaria larva. So I realize that I just need to make sure that schistosoma gets the S wala sound. Schistosoma gets the S, Cercaria larva. For all the others, it is Metacercaria. Similarly, if I ask you the mode, for all of them, the mode is going to be ingestion. For each one of them, the organism is basically going in via the oral route. But schistosoma doesn't want that. Schistosoma wants S. So schistosoma is going to get it via skin penetration, right? So another S which has come, and this was a previous year question. Which organism or trematode comes via the skin? Skin ke liye schistosoma. Okay, now coming to the other ones. What are the adult worms? Now this is again a previous year question. All the adult worms are going to be hermaphrodites. But again, schistosoma is not happy with that. Schistosoma needs something with S. So schistosoma says, no, keep my male-female sex separate. So remember, schistosoma has sexes which are separate. Separate sexes are noted, and that's another S that you have in this domain. Now let's come to the eggs. You can see all of them have a common egg. What is this egg? The egg which has a lid. What is that lid wala egg known as? Operculated. Have a look at the eggs on a separate slide. Whenever you see an egg with a lid, I've just taught you in the previous chapter that that is going to be an operculated egg. An operculated egg is seen in STD. Can you quickly revise this mnemonic for me? What was S? S was for Spirometra, which was a cystode. D was for Diphyllobothrium latum, which was again a cystode. And T is what I'm talking about over here. These are going to be the trematodes. But again, schistosoma says, no way, I'm not going to follow this. I need my S. So I am not going to show you the operculated eggs. What will I show? Schistosoma says, I need an S. So I will show you spinous eggs. And these are the three spinous eggs which are put up next in front of you. So where is the spine over here? If I look like this is looking like the terminal spine. Terminal spine matlab, which is the organism that is going to show you? It is going to be schistosoma hematobium. So I have to look out for the T, that the terminal spine is going to be seen in schistosoma hematobium. Next, where do I see this lateral spine, the one that is going on the side? So if they ask you where do you see lateral, lateral sounds like leta hua. Who is going to be leta hua? The sleeping man. That is schistosoma mansoni, sota hua man. That is how I've learned it. Sota hua man is going to show you leta hua, that is lateral spine. And finally, if the spine is not seen only, I don't see any spine around it, round sa hai, you'll say, ma'am, the spine has gone missing. That is a rudimentary spine. That when you're talking about a rudimentary spine, that is something you see with schistosoma japonicum. There are two mnemonics for it, whichever suits you, you can learn. Either you learn that Japan is spineless, Or you can learn that Japanese people have as a round faces, so that is how it's going to look like. So your eggs are done. All of them are going to have the lid wala operculated eggs, but Schistosoma needs its S, so Schistosoma is going to have spinous eggs. Now I'm going to go into a treatment aspect. I'll come right in the end. I'm going to go into the individual details of these, right? So let me tell you that Schistosoma is actually going to be of three types. We have Schistosoma hematobium, Schistosoma mansoni, and Schistosoma japonicum. Schistosoma hematobium, did you wonder why did we call it hematobium? Because this is famous for causing hematuria. Means it's going to go into the urinary bladder. And which cancer of the urinary bladder does it cause? In the urinary bladder, it causes squamous cell carcinoma more commonly than transitional cell carcinoma. So your previous year question was Schistosoma hematobium, hematuria wala, does it cause SCC or TCC in the bladder? So answer is both. But what does it cause more commonly? So Schistosoma obsessed with S, it most commonly causes squamous cell carcinoma. So which veins will it go to? Urinary bladder mein jana hai, this means it's going to go into the vesical plexus. It's going to go into the vesical venous plexus, as simple as that. Whereas the others, I'm going to draw a line over here. The others which I have, that is Mansoni and Japonicum, they are intestine wala. They are not the urinary bladder ones. So please note that Mansoni goes into the inferior mesenteric plexus and Japonicum is going to go into the superior mesenteric plexus. And what do they involve? So plexus is not what they ask you. They ask you small intestine or large intestine. So remember, Japonicum goes into the ileocecal region. Ileocecal region is Japonicum, whereas Mansoni goes into the large intestine, that is sigmoidorectal. Favorite previous year question, easy way to learn it. J and I ko saath saath rakhna. You have to keep the adjacent alphabets together. So IJ. IJ is your mnemonic. Japonicum goes in ileocecal junction. Next, you have to know if they ask you severe forms kaun karayega. Who is going to affect the CNS? Who is going to cause genital schistosomiasis? So Japonicum is quite rudimentary spine wala na, quite spineless and severe. Japonicum is spineless and severe. It's going to cause severe things like CNS involvement, genital involvement. Now I'm going to tell you overall what is the disease known as. The disease that schistosoma causes is the very, very famous schistosomiasis or bilharziasis. Let us do a review of it once again. This is what exactly I taught you in your main videos. There is acute schistosomiasis and chronic schistosomiasis. Acute mein hamesha fever hoga. So this is going to cause Katayama-like fever. And chronic will always have fibrosis. And I'm going to show you the exact picture that I have shown you in the main videos also. What is pipe stem fibrosis? Favorite previous year question. Have a look at it. We label it once again. Look at this, guys. What is this red thing that you're seeing? Ma'am, ye liver hoga, brownish liver hoga. And all these white areas that you're noticing over here, that is a pipe stem fibrosis. Very famous question. Where do you see pipe stem fibrosis? I see it with which infection? We see it with schistosomiasis or bilharziasis. Okay, now let me show you the life cycle, because everything that I had told you is fit over here. Firstly, you pick up the host. I can see a human being and I can see a snail. As soon as I see a human being and a snail, I know that, oh, I am talking about a trematode family. But now what is the second host? There is no second host. That means if it is only between human being and snail, it is a case of schistosoma. Let me confirm. What is the infective form? Schistosoma ko ma'am S chahiye. It needs that Cercaria larva. How do I identify a Cercaria larva? By its forked appearance. Yes, I can very well appreciate there is a Cercaria larva in the story. And how will it come? Ma'am, S ke through aayega. It's going to come via skin penetration. It's going to come via skin penetration. Another S. Then, hermaphrodite hai, sexes are separate. Male, female worms are separate. So, sexes are separate. Again, another distinguishing point for schistosoma. How are the eggs? S. Ma'am, all the eggs over here have spines. Of course, another S in front of me. Spinous eggs. Definitely a case of schistosoma. So, देखो SSS चलेगा cycle में. You're dealing with the case of schistosoma. Now, what you need to know is what is happening beyond the eggs. Beyond the eggs, I'm not just telling you for schistosoma. I am telling you in general for the entire trematode family. For the entire trematode family, once the eggs are there, you will say, ma'am, eggs में से क्या निकलता है? What happens in the environment? In the environment, we have something known as MCRC and then back to M. I'll tell you how. What is MCRC? The first form that is formed is Miracidia. Then we have a sporocyst. Then we have a rhidia. Then we have that forked Cercaria larva. And after Cercaria larva, why am I saying we'll go back to M? We're not going back to Miracidia. We will go back to M in our mnemonic. And that means the next one is going to be Metacercaria larva. So tell me something. Firstly, everyone please ratta lagao. What is MCRCM? MCRCM is first Miracidia is formed, cyst is formed, Rhedia is formed, Cercaria larva, back to M matlab Metacercaria larva. Out of these, what is not? All of these are present in the entire trematode family. However, in Schistosoma, you will say that ma'am, out of MCRCM, Metacercaria larva to nahi hai because the infective form is Cercaria larva. So please remove this. And also the Rhedia is not there. So overall, Schistosoma mein only MCC is there. The Miracidia, the cyst, and the Cercaria larva. The Schistosoma started off with M and then said, "Arey, I am so obsessed with SSS wala sounds. तो सिर्फ SSS wala sounds रखो, cyst रखो and Cercaria रखो. Don't keep all these other things." All the trematodes have all these things, but Schistosoma only has MCC, Miracidia, cyst and Cercaria. So come to the life cycle and you will now see that yes, there is a Miracidia written over here. After the Miracidia, I will see that MCC banega, cyst bana, and uske baad another Cercaria larva, to MCC bana, and that is the story. So this is the previous year question that you get, that Rhedia is not seen in which of the trematode cycles? Schistosoma mein nahi hota. So everyone is clear with Schistosoma, done with it. So now I can say it was going in so many venous plexuses. I can finally call it what fluke? You will keep on completing their names now. You are now going to call it the blood fluke. Let's move on to the next one. Have a look at this one, guys. Let's see if you are able to pick this up. It's quite simple. Be very cautious. Look at the host. Yes, I can see the famous human being over here. And I can see a snail over here. Okay, so this much is certain that human being and snail hai to trematode family hai. Plus they have written something like a crustacean. मतलब कुछ crab या crayfish है मैम. There is a crab or a crayfish mentioned over here. What is this? Cara crab, Paragonimus. Paragonimus westermani is the case that has been shown over here. Now I need to know details about this. One more thing I'm seeing is, okay, eggs are coming out and ma'am, इसमें तो अब normal MCRCM दिखेगा ना? Yes, I can see Miracidia, then Sporocyst, then Rhedia, then Cercaria, then Metacercaria. Perfect, MCRCM, सब कुछ दिख रहा है. And everything had to be via ingestion. So now I've left that SSS wala story. Now I'm going on to the usual one. So what is the infective form? Metacercaria larva is going to come via ingestion. The worms are going to be hermaphrodites. No sexes separate are seen. But now you need to know what is the clinical feature of Paragonimus. Do you know P for Paragonimus and P for pulmonary involvement? So this is going to show you pulmonary involvement. GIT involvement to har kisi mein hai. This will also show you pulmonary involvement. This means the eggs will be seen in the sputum because of pulmonary involvement. The eggs will be seen in the stool because of GIT involvement. Was that the case? Yes. If you realize that in this history, they are showing you that the eggs are coming out in the sputum. See, the eggs are coming out from the nose also, you can see. They are coming out from the mouth, from the sputum, and the eggs are also coming out in the stool. Whenever you see this lung wala trematode, so this is definitely going to be Paragonimus. This means what is the other name, guys? I can finally come to the other name of Paragonimus. It is going to be the lung fluke. Lung or the pulmonary fluke. And simple way of learning it is P for P. Okay, let's move on to the next one. Let me show you another life cycle over here, and I hope you are able to pick it up because it's already written, but it's very simple. Ma'am, I saw a human being, and then I saw a snail, and snail ke saath I saw a fish. So either it is clonorfish or it is opisthorophish. Now all of these, clonorfish, opisthorophish, these are all the liver flukes. So you have to know the names of all these liver flukes. And it's quite simple. Nothing is very difficult about it. See, clonorfish, opisthorophish and opisthorophish. So clonorfish sinensis or Clonorchis sinensis, C से start होता है, तो it is gonna cause what? It is gonna cause Chinese liver fluke. Okay. Opisthochus viverrini and Opisthochus felineus. Feline always refers to cat, so that is known as the cat liver fluke. Viverrini is known as the Southeast Asian liver fluke. Fasciola hepatica, ma'am, this you have already told us. Fasciola was sounding like sheep. So this is going to be the sheep liver fluke. And Fasciola gigantica, word is only telling me this is going to be damn giant. This is going to be a giant liver fluke. So jaldi repeat. Clonorchis is going to be Chinese. Opisthochus viverrini, Southeast Asian. So Opistholcus felinius is referred to as the cat, feline. Hepatica fasciola is going to be sheep, and Fasciola gigantica is giant liver fluke. So I hope now when I come back, I can also tell you what are the things that it's going to cause. So this is a very famous pathology thing, Clonorchis and Opistholcus cause all with C's. Liver fluke थे ना, तो मैम liver का कौन सा part? It is going to affect the bile duct. They cause cholangitis and they also cause which cancer? Cholangiocarcinoma. So simple. The question that comes is that which liver involvement is occurring. So cholangitis and bile duct cholangiocarcinoma is what is going to occur. In those same liver flukes, I had also studied Fasciola hepatica. This was also a liver fluke that I had, and I already know a sheep liver fluke hai. I already know the other name. So liver hai, to what all does it cause? Ma'am, common sense, jaundice hoga, right-sided liver pain hoga, that no one will ask you. But remember, Fasciola hepatica causes halzone. Halzone is what? It is a kind of a suffocation. Patient suffers from a kind of a suffocation. Why? Because there is an involvement of the pharynx and the larynx. Basically, there is a pharyngeal and a laryngeal involvement, and there can be a kind of an edema that can occur, because of which patient will suddenly, so I have learned halzone is like hafna. He will be really panting for breath and he will be feeling very, very suffocated. So hafna किसमें होता है? Hepatica, Fasciola hepatica में patient will be suffocated. Hafna, halzone. Finally, coming to the last one, Fasciolopsis buskii, because now I think we have done all the names. Fasciolopsis buskii is the one that is going to be intestinal fluke. It is going to be the intestinal fluke. So the last thing that you have to know is that this is the list of all the intestinal trematodes. Because you don't have to know their names. I'll tell you what you have to know. Fasciolopsis buskii to I learned. Buskii matlab intestinal. All of these, Heterophyes, Metagonymous, Echinostoma, Ileo matlab ileum, all of them are going to be which intestine? They are going to be small intestine. In sub mein se the question that you have to learn is Gastrodiscoides hominis is the one that is going to involve the colon or the large intestine. But that's the question. All of them involve the small intestine, but Gastrodiscoides hominis is going to involve the large intestine. And I think now we are done with the entire trematode. So now when you revise trematodes the next time, first do this particular table of all the hosts. Next, do this particular table of the mode of the Metacercaria and Cercaria larva, the sexes and the hermaphrodites, the eggs, and I'll wrap it up with the treatment. Here, the history ka difference is not to do with schistosoma. So please remember, the treatment for all is going to be praziquantel. I will write praziquantel once. So it is going to be praziquantel for all, and that is what I'll copy paste everywhere. But for Fasciola hepatica, it is triclabendazole, and that is what I wanted you to know. It is triclabendazole because praziquantel does not give a good response. So only for this sheep liver fluke, you will remember triclabendazole. Bas. After that, everything else is treated by praziquantel. I hope now the trematode family is done. Overview is over. Let's start with the last part of the rapid review of parasitology, and that is the nematodes. If you know the classification and the eggs of nematodes, half your life is sorted. So let's get going to the classification as per the habitat. Which are the ones which are going to involve the intestine and the ones which are going to go everywhere else in the body, and that is somatic. So who is going to roam around? I've just learnt it as roam around in the body, and they're roaming around in a manner, they're singing a song called La La Lu. The ones who are singing and chilling, singing La La Lu, they are going to roam around everywhere in the body, and that means Filaria, Trichinella and Dracunculus. So La La Lu organisms are going to roam around everywhere in the body. Others are going to go into the intestine. So which are the ones which go into the large intestine? They are going to be two organisms. So I've learnt it by Lett, and that includes number one, the Enterobius and T for Trichuris. So always remember Lett, Enterobius and Trichuris, they are going to go into large intestine. Now whatever is left, roundworm, hookworm, strongyloids, whatever is left is going to go into the small intestine. Now because they have been given a small intestine and a small home to stay in, they say we want compensation. You will have to give us one extra room. They are also going to involve the lung. So lung stage is going to be present in which of the following trematodes? It is going to be the small intestine wala. So remember guys, very, very important point for all of you to know. Somatic ones are Trichinella, Filaria, Dracunculus, La La Lu. The large intestine ones are Enterobius, Trichuris. Everything else is small intestine, and small intestine ones also have a lung stage. Now coming to their classification on the basis of what are they going to give birth to? Will they give birth to eggs or will they give birth to larvae? So please note that if they give birth to L for LA for larva. So remember, if they give birth to larva, they are said to be viviparous. Whereas if they give birth to eggs, they are ova. They are oviparous. Eggs में से you will say, ma'am, eggs में hatch होगा तो later on तो larva is only going to come out. बिल्कुल. But initially, what do they give birth to? They give birth to an egg. Whereas that is known as oviparous. But what is ovoviviparous? That the ovo means egg. They gave birth to an egg and immediately the larva came out. Have you heard of that famous Hindi saying, Phata poster nikla hero? So it is like a very strong hero has just come out of the screen. So the egg has just immediately bursted out into a larva. Who will be able to do that? Strongyloids. So remember, strongyloids, I'll write it again for you. The strongyloids is very, very strong. So that is the one that will be able to immediately break the egg and come out. That is ovoviviparous. Whereas all the larva wala who are going to give birth to larva, the Lu organisms, Filaria, Trichinella, Dracunculus, Filaria, Trichinella, Dracunculus, they are going to give birth to LA for larva. They are viviparous. And which are the ones which are going to give birth to eggs? Either you can learn all of the others, but you can also learn that later on the larva will come out. Later on matlab T for Trichuris trichura, E for Enterobius, and R for the roundworm and the hookworm. So remember, later on the larva will come out. That is Trichuris, Enterobius, roundworm and hookworm. So this is your classification as per the eggs or the larva. And now what are these eggs that I'm talking about? So the first summary that I've got for all of you is regarding the eggs over here. So please note guys, very, very important. Look at this. The first one, which is looking bilkul aisa round, that is said to be the Ascaris egg. This is the roundworm wala egg. And this can either be a fertilized egg as you can see over here, or it can be an unfertilized egg as you can see over here. Fertilized egg said, I will say yes, yes, yes to everything. And no fertilization said, I will say no, no, no to everything. Means if I say which of them will have a thick albumin coat, which of them is going to have a thick albumin coat. So fertilized says I will have and non-fertilized says I will not have. Second, which of them is going to be having a, can you all see if I erase this and if I show you, can you notice there is a space over here in this much area, a crycentric space like this, and at the bottom also there's a space like this. So fertilized egg as it. So basically if they ask you which of them is going to have a crycentric space, you will say simple hai, fertilized is going to have everything, non-fertilized will not have anything. Finally, who will be floating on saturated salt solution? Fertilized will float, non-fertilized will not float. So fertilized says I will say yes to everything, non-fertilized says I will say no to everything. That is a roundworm egg. Now we come down to Trichuris trichura. What is the shape that you can see over here? These are basically barrel shaped eggs. And in those barrels, if I make a barrel like this, you will say, ma'am, I need something to close it from this end and this end. So these barrel shaped eggs are going to have mucus plugs. But how I have learnt it is that instead of these mucus plugs, I have made one T plug it here and one T plug it here. 2 pins I have put on this bomb and I have plugged it. So that is basically Trichuris trichura. These 2 T's that I have put up is only my mnemonic for learning the Trichuris and trichura. I hope you understood this. Now coming to ankylostoma. Ankylostoma is what, guys? What is the other name for ankylostoma? It is nothing but the hookworm. So how do you write it? You write hookworm like this. That is how I always tell you to write hookworm, because it has double O. Matlab, the egg is going to show you a lot of segmented. This is what the egg is going to show you. There are somewhere blastomeres present in the egg. ऐसा hooking वाला egg होगा, ऐसा OO आएगा, that is hookworm वाला egg. Finally, coming to Enterobius vermicularis, how we have learned it is Enterobius vermicularis has a D-shaped egg. D-shaped egg matlab E for Enterobius vermicularis. D means one side is plain and the other side is convex. It is a plano-convex egg. Dekho, one side is flat, one side is round. One side is flat, one is round. Flat, round. So this is going to be a flat and a round, plano-convex D-shaped egg. And if you look carefully, it has a larva. A line is going inside it. It has a tadpole larva inside it. Inside it, we see the very famous tadpole larva. Quick revision. Roundworm wale eggs look round. Trichuris trichura looks like barrel shaped. Hookworm shows you blastomeres like O, and D-shaped egg is seen in Enterobius vermicularis. all your eggs are done, all your classifications are done. Let's pick up all these organisms one by one. I've got one table for all organisms and the story is going to end in 10 minutes. When I'm talking about Ascaris, lumbricoids, or you can say roundworm, what is the, you can see the life cycle is in front of you. What is the mode of, how are we going to get it? It is going to be by a mode that is known as ingestion. What are we going to eat? Anything that has been embryonated. Embryonated egg matlab the egg which contains the larva. So the embryonated egg, as you see over here, the embryonated egg is something that we are going to eat up. Okay, after we eat and we know that, okay, worms banenge, what are the adult worms? You can see the male and the female in front of you. The longer one, now the rule is that the longer one, female or male may, the larger one is always going to be the female. As you can see over here, the larger one is the female. Male may always remember the posterior part is going to be coiled. That is how you identify the male. देखो roundworm है, this is very important because you know that nowadays adult worm questions are coming a lot. So the female, देखो सबसे पहले तो it's looking a little round. Can you all appreciate the overall body is round? That's why it's a roundworm. The female is definitely much larger and the male is going to have a posterior end which is coiled, and that is how you differentiate between them. Okay, so I can definitely see the males, and the males have, can you see two types of eggs are laid down? I just taught you these eggs, the fertilized egg and the unfertilized egg. So yes, that is what you see in the stool, the diagnostic stage. What will you see under microscope? These are the eggs. Karata kya hai? This is very famous for causing malabsorption. So that is what we say, roundworm causes malabsorption, and it can also involve the lungs. That is going to be Loeffler's pneumonitis. Ma'am, how does it involve the lungs? Because guys, I told you roundworms were going in which part of the intestine? Roundworms were going in the small intestine. Anything that has been given small place to stay has been given a compensatory room also, and that is lungs. So definitely it's going to show you a lung stage also. Till I don't change it, the treatment of all is going to be albendazole. Of all, it's going to be albendazole. Let's move on to the next organism. The next one that we have is Trichuris trichura, which is known as a whipworm. It looks like a hunter, and that is why it's a whip. How will I know between the male and the female? Ma'am, sabse pehle to this is looking like a hunter. Both of them are looking like a hunter. So which is going to be the one which is going to have a posterior coiled end? Of course, this is the male. The posterior surface is going to be coiled, and that is always going to be the male for us. How are the eggs going to be? We always know that we have, I've already told you, we have barrel shaped eggs, and they are closed by what? They are closed by mucus plugs. These are the 2 points that you know. Now let's go into the life cycle. You can see the life cycle is so easy to pick up because barrel shaped eggs dikhega. So what are we consuming? We are consuming the embryonated eggs. How? Again, we are eating it. What are we going to see? Again, diagnostic stage also what I'm seeing is going to be is initially, let me tell you what we see. I want you to be very cautious over here because here is where students make a mistake. Initially, what is passed on into the stool is going to be the unembryonated egg. So if you have an option of marking unembryonated egg in your diagnostic stage, please mark that first. If that is not there, then you mark embryonated, because unembryonated is passed and later on it's going to become embryonated out here. So un का अगर option होगा, mark unembryonated. Also, it's a hunter. अब hunter से hit करोगे तो bleeding तो होगा, right? So what is it going to cause? It is going to cause blood in the stools. It causes dysentery. Plus, it is going to affect the rectum. What can it cause? Can you see? This is a picture of the rectum, and I can see so many hunters attached onto it. They're looking like coconut flakes. So this is known as coconut cake rectum, and also it can result in rectal prolapse. Treatment, till I don't change it, it is always going to be albendazole. Let's move on to the next one. The next one that I see over here is going to be the Enterobius vermicularis. Now, firstly, why did I say vermicularis? Because where does it go? It goes and lodges in the vermiform appendix. Vermicularis ka matlab vermiform appendix. Perfect. Now, what is the adult worm going to look like? Very, very important. Have a look at this. Again, male, female to identify karna aa gaya na. The female, this must be the female because it's bigger. And this must be the male because I can see that the posterior end is coiled. If the posterior end is coiled, it is definitely the male. But how do I know this is an Enterobius vermicularis? Because I will see that the head has these two projections. Actually, there are three, but this is a picture like this. You can't see a full 360-degree view. There are three projections, and those are known as cervical ala. So whenever, guys, please note, whenever in the paper they give you an organism which has three cervical ala, you are going to pick it up as Enterobius. Let me show you a histopathology picture of this. You get this picture in pathology also. If you see an organism, so let me say, they will say there is a specimen that has been taken from the appendix, and in the appendix I am seeing the presence presence of these worms, and you'll say, acha, these worms have these two spines over here. What are these? These must be the cervical ala. Ek to dekho, cervical ala hai, that is telling me it is Enterobius vermicularis. Secondly, this is in the appendix hint given, that is further telling me it is vermicularis, and it is very patla. Why does it go in the appendix? Appendix is this much, na? How can someone go into the appendix when it is very patla, like a pin or a thread? So that is what Enterobius is known as. Now, if I look at the life cycle, what am I consuming? Consuming. This means the mode is going to be ingestion of what? Of the embryonated egg, and then we are going to have male and female, the ala wale worms that will form. But now there is a very interesting story. If you guys remember, I used to tell you, I won't repeat the entire story, but this will certainly help you in solving questions. Now, we always say that there is a male and there is a female, but where are they present? We are saying, acha ma'am, Enterobius was coming in that let mnemonic. So Enterobius must be in the large intestine. Yes, this is where the male and female are sitting, but the eggs are not laid down over here. The male dies after mating. Please remember, the male came in this world only for mating. After it is undergone mating, after the female has become pregnant, the male has died. Then what does this poor female left alone do? Night time, she travels all the way to the anus and gives birth to her children over here. She does not give birth to her children in this part of the intestine. She travels all the way down and she gives birth to her children over here in the anal canal, right? So this is going to result in perianal pruritus. So how will you see the eggs? The eggs that I will see under the microscope, the diagnostic stage, that is not seen in the diarrhea sample. That is seen on a perianal swab. Either you will have to take a perianal swab or you will have to take a Scotch tape method. Let me show you these two pictures. Either you will have to take an NIH swab. Perianal swab ka naam hota hai NIH swab. So either you will take a swab from the perianal region. If it is a bacha and he's not allowing you to take a swab, then what you can do? You can stick a tape overnight in that area. So Scotch tape method will be used, and then all the eggs will stick because the female will come at night and she will lay eggs in this perianal region. There will be pruritus, and then you will see that all the eggs will stick onto this tape, and then you will be able to see those D-shaped eggs the next morning. Right? So please remember, now imagine someone is having so much of infection and so much of itching. Is that person going to itch with his nails? Quite a gross thing, but that person is going to itch, and from the nails, if the eggs get into the nails and that person eats food, is this also going to result in auto-infection? And that is what they ask you. Yes, this is one of the organisms that causes auto-infection. Coming to the next one. What is the next family that we have? Abhi tak everything, ma'am, you were saying we are eating the eggs. Abhi we've done three organisms. Roundworm, we were eating the embryonated egg. Then we did Trichuris trichura, eating the embryonated egg. Enterobius vermicularis, eating the embryonated egg. Okay, for all of them, the diagnostic stage was for Enterobius, embryonated egg. Diagnostic stage of roundworm, the fertilized and the non-fertilized, dono type ka eggs. But for Trichuris, I told you, kuch thoda trick hai. Agar unembryonated is written, then try to go for unembryonated over embryonated for looking at the diagnostic stage. So, abhi tak you were eating the egg, giving birth to the egg. That is what you were doing. Now, I'm going to take you on to something known as hookworms. There are two hookworms that you have. There is an New World hookworm, new Nectar americanus, and there is an Old World hookworm known as Ankylostoma duodenale. And finally, if you remember, hookworms are the ones which are not going to be eaten up as eggs. Through the skin, we are going to have the filariform larva that is going to enter into the body. Through the skin, the filariform larva enters. Okay, so now I'll show you one life cycle of this, which is very, very famous. Just focus on the life cycle that we have over here. So just ignore the other one. I would suggest that you please ignore this particular life cycle over here and just focus on the one on the left. So what do you see over here? They have written something called an L3 filariform larva, and that filariform larva is basically coming through skin penetration. Yes, and then I can see ek aur agar acha ma'am exam mein itna sab yaad nahi aaya, but could you see the eggs had a lot of those O wala? So this much I know that definitely this is a hookworm egg that has been given birth to, or that has been shed in the feces. And then after that, what forms from an egg? A rhabditiform larva forms. Rhabditiform larva ke baad filariform larva forms, and that filariform larva is basically going to come into the skin, and that is what I'm teaching over here. So through the skin, the filariform larva is going to come, and what are you going to see in the diagnostic stage? We are going to see the unembryonated egg in the diagnostic stage. I've already shown you this unembryonated, and these segments that are present, so the egg is already visible to you. So So now think something, if something is coming through the skin, so is it going to result in itching and eruptions? Of course. And usually foot se aa raha, so it's going to cause creeping eruptions, ground itch, and it is ultimately going to the intestine. So is it going to cause iron deficiency anemia, which you have studied in your pathology lectures also? Iron deficiency anemia is associated with hookworm. And let me ask you one more thing, B12 deficiency was associated with the cystode that I taught you earlier, and that was Diphyllobothrium latum. Acha, these are the adult worms in front of you. Coming back to the hookworm, the adult worm, male कौन सा, female कौन सा? मैम मेल में पीछे कुछ होता है, मेल में, in the male पीछे, here there's no coiling. In all the other males there was coiling. Here we can see there is an umbrella like flattening, and that is known as the copulatory bursa. So the back side is flattened like an umbrella, like a peacock, he has put out his wings, and that is what you have. Now if I have to differentiate between the new world Nectar americanus and the old world, you will realize दोनों का eggs are the same, दोनों का rhabditiform larva is also the same. So please remember, the eggs and the rhabditiform larva of both the hookworms is the same. The difference comes in the adults and the filariform larva. And what is the difference in the adults? Please remember, I'm going to show you the difference in the adults over here. Have a look at this. You look at their head and you look at their tail. Okay? So here I've got you the old world wala, here I've got you the new world wala. So if you can look at these two pictures, the head end, then these two pictures, the tail end. Same pictures I've got you over here. This is the head end and this is the tail end. So dekho, what do you have in Ankylostoma duodenale? This was the old world wala. Ma'am, old world terminology is teeth. I can see a total of 6 teeth. 1, 2, 3, 4 on the front and 2 on the back. So I can see a total of 6 teeth. But New World wala has stopped using the word teeth. It says, oh, teeth is too old school. I will call them chitinous plates. So it has 1, 2, 3, 4 cutting chitinous plates. So remember, the old world had 6 teeth and the new world calls them 4 chitinous plates. That is the adult worm difference number 1. Now let's come on to the end. So this was basically what? This was the difference that you had in the buccal capsule, the mouth. Whereas if I talk about the difference in the tail end, I will see that there are 2 spicules which are coming out from here and 2 spicules which are coming out from here. So if I see that the 2 spicules are free, it is an old world. And if I see the 2 spicules are fused, that is the new world. Old world mein log free rehte the, new world mein people are very, very busy. So old world mein the spicules are free. You can see these black spicules, they are totally free. And in the new world, they have basically come down into a fusion, and that is how you differentiate between them. I hope everyone is clear with this, because if you ask me who is more pathogenic, remember old world is still more pathogenic, but वो जो itching वाला phase है, ground itch, where the filariform larva enters, that is going to be more in the new world. तो new world में itching ज़्यादा है, new world वाले में itching is more, but pathogenicity wise, the old world is more something that is going to be pathogenic. So now we are done with all of this, and I think because I'm talking about the skin aspect of it, let me tell you one more organism which is very important from the skin aspect, and that is Strongyloid stercoralis. Again, firstly, it sounds like a Strongyloid stercoralis. You will feel some hulk is coming up, but this is the smallest nematode that you have. And this also comes via the skin. This is also going to be the filariform larva. Tell me one thing, Strongyloids, was it viviparous, oviparous, ovoviviparous? You said, ma'am, strong tha. You gave us a story of Fata poster Nikla Hero. It's very, very strong. It's immediately going to come out. I will never see the egg. As soon as the egg is given, it's immediately going to come out. So in my diagnosis, will I ever see any egg over here? No. You will directly see the larva coming out. So you will see in this life cycle for Strongyloid stercoralis, which is the larva that is going to enter into the body. It is the filariform larva. And whatever male, female, जो भी बनेगा, what egg lay down होगा, but will you even be able to see it? No, ma'am, because immediately the egg is going to hatch into the rhabditiform larva. So what is going to enter into the body is going to be the filariform larva. What you're going to see is going to be the rhabditiform larva, and when it enters through the skin, it causes cutaneous larva migrans. It causes cutaneous larva migrans. Now please note, I'll show you this life cycle a little differently, because ये strongyloids है तो smallest but काफी strong life cycle है. Means what? Firstly, everywhere I show you male and female, but this is the only life male होता है. देखो, male exists, but females over here are very independent and very, very strong females. They are strong females. They say we will be able to do our kid on our own. That is known as parthenogenesis. Parthenogenesis means that can they also follow an asexual reproduction? Yes, the female alone can also do a reproduction. After that, is it possible to have auto-infection because of strongyloids? Yes. When there is egg, that as soon as the egg will lay down, the same larva will come out and infect the body again. The same larva is going to come out and infect the body again. So auto-infection is possible. Then there are two more cycles possible, direct and indirect. You say, ma'am, जब वो egg में से rhabditiform larva निकला, either it can keep its life direct and simple. That rhabditiform larva says, "Arey, let me directly form filariform larva and let me come back into this human being. Direct filariform banao, aa jao." Indirect long route will be that no, rhabditiform says, no, let me form male and female parents. They will again lay down eggs. Again, they will lay down rhabditiform larva. Then I will come into filariform larva. Itna lamba route it has taken. That is why it's the indirect cycle. So simple. Now I realize that this strongyloids can show you many things. Number one, it can show you asexual reproduction as parthenogenesis. It can directly transform into filariform and come in the body. It can take the long route of making male-female worms, then an egg, then a rhabditiform larva, then a filariform larva, then long routes are coming into the body. Or it can directly come from the body, inside the body only it can keep infecting you, and that is known as auto-infection. So sounded a little strong, but now I know कि size में तो strong नहीं है, it is छोटा, but life cycle very, very strong. And finally, I can tell you that here you are not using albendazole, here you are using ivermectin. So the treatment over here is going to be ivermectin. Last thing, oh, this is the only one where I didn't show you any anda, no egg over here. Why? Because you're going to see a rhabditiform larva. And how do you differentiate a rhabditiform larva? How do you see that rhabditiform larva? You will identify it by this esophagus. Can you see the esophagus has this constriction? You call it a double bulbed esophagus. That is what they ask you in the paper. The rhabditiform larva is going to show you the double bulbed esophagus. All these intestinal ones are done, guys. I am now going to go into that Lu category, Trichinella, Filaria, Dracunculus, because now I'm not talking about intestine. Now I'm going to go into the story of the somatic worm. So now I come to Trichinella, and this is what you need to know about Trichinella spiralis. So first and foremost, spiralis hai. So there is always, if you remember, Trichinella is the one that causes cardiac involvement. Cardiac matlab muscle. Ma'am, ye kuch muscle mein jayega. Before I go into that, how do I differentiate male and female? Ma'am, female as usual is going to be larger and male is going to be smaller, and male ka jo posterior end hoga, us pe kuch to hoga. And over here, the male's posterior end has these two fork claspers. Why? Because it has to catch the female for mating. Claspers have to hold the female during mating. That is why Trichinella is going to be catched by the claspers in the male end. So the next organism that we start with is going to be Trichinella spiralis, and the best way of identifying this is look at the life cycle and you see a human with a pig. So definitely there's a host which is a pig which is needed, and there's going to be a human being mentioned. So firstly, let me identify the adult worms. As usual, the female is going to be larger and the male is going to have something at the posterior end, and that posterior end are two forks that are known as claspers. Why are these claspers? So that it can hold on to the female during mating. That is the purpose of these claspers, right? Now there is something called encysted larva. So what is this encysted larva meaning? Let me show you the life cycle. So when you ask me that how is Trichinella spiralis present in the pigs, it is present in the muscle. And how is it going to be present in our body? It is again present in a muscle. So can I say that this is always going to take the support of a muscle fiber? And because muscle is nursing it, muscle is said to be a nurse cell, and what you see inside it is going to be an encysted larva. So if you have to eat or get this infection, you will be eating some encysted larva in the poke. Undercooked poke is what you will be eating, and how you will be getting this infection. So in your body also, where is it going to go? It's going to go in some of the other muscles. So if it's going in muscle, how will you do the diagnosis? Of course, it's going to be a biopsy, which you can take near the insertion of the deltoid, and that is what you need to know about Trichinella. If it's going into muscle, I hope you remember one of the muscle means that it is capable of causing myocarditis. Cardiac muscle may be ja sakta hai. And the treatment, as always, albendazole for everything, but for strongyloids, it was ivermectin. So this is Trichinella. We are on that Lu organism. The next one is going to be Dracunculus, but I know Dracunculus medinensis, which basically means guinea worm infection. And guinea worm is something that has been eradicated from the country. Why? Because guinea worm was something, why is guinea worm, how was guinea worm eradicated? Because I realized realized that guinea worm was something that is happening because of drinking dirty water. Why? Because dirty water contains cyclops, and cyclops was basically containing the L3 larva. The cyclops was containing the L3 larva. So by drinking water with cyclops having L3 larva, we were getting this infection. So they said, clear the water, clean the water. So it has now been eradicated due to clean drinking water. Due to clean drinking water, it has been eradicated, and also this is going to be the L3 larva which has been consumed. So अब वो clean drinking water होगा, so that will not be consumed, and hence it has been eradicated. But when it was there, we realized that when we were drinking this clean water, the L3 larva was making the adult worms, and then that adult worms matlab male female mating was going to happen, and then the gravid female decided that I will give my delivery in the subcutaneous region. Where will I give birth to my kids? I am going to give birth to my kids in the subcutaneous plane. So what is she going to do? She's going to go and sit in this subcutaneous plane in a tunnel, and as soon as she has to give birth, you will see the larva will be coming out. So that is why you can see that the adult worm giving birth can be seen, and they've shown you a picture over here where you can easily take that adult worm and larva out with the help of a matchstick. So this was done. So this makes blisters. In short, if you see that there's a person in the water having blisters, and with a matchstick this kind of a larva, the adult worm is laying down the larva which can be coming on, that is guinea worm. But again, it has been eradicated. So you know what is the diagnostic stage also. So trichinella done, dracunculus done. What we are going to go on to next and last is going to be filaria. I know this is the table that you were waiting for, so I just have 3 tables to teach you in filaria, because in the rapid review I'm not taking up all the lymphangitis and all of that. वो सबको पता है, elephantiasis. Your main concern is what is the morphology of these. So you always divide this table into 2 parts, and what am I comparing? These are the microfilaria, and I am interested in knowing what is their end going to show me, the posterior end going to show me. So why have I divided it into 2 parts is that these 3 over here that we have, they are going to be sheathed. They are going to be sheath larva. Can you see there's a orange color ka sheath around them, है ना? And whatever I have other side is going to be unsheathed. So पहले तो I learn these. So sheathed कौन से हैं? Sheathed are LBW. LBW means that there is loa loa, there is Brugia malai, and there is Wuchereria bancrofti. So sheath larva is going to be LBW. So how will I differentiate between them? तो देखो Wuchereria bancrofti. Do you see any nuclei going at the tip? नहीं मैम, nuclei have stopped over here. They are not going on the tip. So I learned Wuchereria में whoosh. Whoosh is the sound effect you use for getting vanished. So please remember Wuchereria में Wuchereria bancrofti is gonna have whoosh. Matlab there are no nuclei at the tip. That is a very famous way of identifying it. Next, when I come to Brugia, देखो Brugia में क्या दिख रहा है मैम? Yes, I can see these 2 tiny little dots are going all the way up to the tip. So Brugia for bi, B for B. So I say in Brugia malai, I am gonna find in Brugia malai, I am going to find 2 nuclei present at the tip. And what is in loa loa? Loa loa में line से मैम, line से लग के they are going right at the end. So loa loa, L for L, loa loa, I am going to see nuclei in a line. That is how you differentiate. So please note in the paper, there is LBW for sheathed. After that whoosh में तो vanish, there is no nuclei. Brugia has how many? 2 nuclei, and loa loa has nuclei in a line. All the others, Manzanella perstans, Manzanella ozardi, Onchocerca volvulus, they are all going to be unsheathed. And remember, only the perstans, only Manzanella perstans will have nuclei at the tip. Persisting at the tip, only this will have nuclei at the tip. Others are not gonna have nuclei at the tip. There are no nuclei present. Manzanella ozardi and Onchocerca don't. Only Manzanella perstans is persisting till the tip. Everyone's identified these, because now you will want to know when do they come out into the blood, what is their periodicity, and what are going to be their vectors, how are they transmitted to humans. So please note the first 4 over here have periodicity. Matlab Wuchereria, Brugia, all the Brugia malai, Brugia timori, loa loa. Matlab ma'am at the end of the day जो LBW था ना, that is periodic. LBW, loa loa, all types of Brugia and Wuchereria, all of them come out when do they come out into the blood? They come out into the blood during the night time. But this loa loa is diurnal. Subha sham, it is loa loa, two words na. One loa comes in the morning, one loa comes in the evening in the blood. So when do they come out into the blood? Or if someone asks you what is their periodicity, you know, LBW is going to come out into the blood but lower during the night, but lower दो बार आएगा, diurnal. Oncocerca volvulus and the other ones जो भी बाकी है, they are non-periodic, they don't have any periodicity as such. On the same lines, you will learn their vectors also. So for Wuchereria, it is everything. Culex, Anopheles, Aedes, everything. So nothing good for me. I don't have to learn anything. Brugia malai, mal for man. Mal for man matlab malai के लिए Mansonia is what is going to be the transmission. Brugia timori, इसके लिए Anopheles. How will I learn? Timori, tumhari, sounding Timori, sounding like tumhari. Ano for anu. So this is going to be a tumhari anu that we will learn. Brugia, tumhari anu. Brugia, timori, Anopheles. Loa. Right now you told me, ma'am, loa, subha sham, diurnal. So something in the vector is also D. Diurnal is the periodicity. Deer flies is going to be the vector. Coming to Oncocerca volvulus. Right now in a while I will tell you Oncocerca volvulus में बहुत black skin होता है. So the skin is also black and the flies are also black. There are black flies. And finally, Mansonella is going to be transmitted by the midges. So that is going to be all the different vectors and the periodicity that you have. Let me ask you a question. So for example, what does filariasis actually show you? I think everyone knows it shows us the famous lymphatic obstruction. And when it shows us lymphatic obstruction, you see this swollen foot and you have pigmentation on the skin, right? So that is known as what? That is known as elephantiasis. Apart from that, it can also show you the presence of chyle in the urine. Chyle in the urine is chyluria. Matlab lymphatic fluid can come out into the urine. Chyluria, milky fluid in the urine. That is what you see. Now you will tell me kaun sa wala filaria. Let's see how much were you listening. पहले बताओ, sheets थे? Yes, I can see this pink color sheets. तो मैम ये this is LBW में से कुछ है. This is something out of LBW. Now let me look at the nuclei. Are the nuclei going all the way up till the tip in a line? Loa नहीं. Are there two nuclei at the tip? Brugia malai nahi. There are no nuclei at the tip. Ma'am, whoosh ho chuka hai. So this is the microfilaria of Wuchereria bancrofti. That is how you will identify this in the exam. Now obviously you will ask me what are the different tests that we have. So सबसे पहले we will do a peripheral blood test depending. Nocturnal है तो you will do a peripheral blood at night. Diurnal है तो you will take the blood sample either morning or night. But you can't call the patient at 2 o'clock in the night, na, that your organism will come at 2 in the night, so you come to my lab at 2 in the night. No. So you do something called DEC provocation test. If you give DEC, they will come out into the blood even at 10 o'clock in the morning. Okay? So DEC provocation test is done. What is an ultrasound? The filarial dance sign is what you see on an ultrasound. Antibody testing कर सकते हो, but कोई फायदा नहीं है. This is usually non-specific. But if you can find out antigen by ELISA is quite specific. If you can learn all, very good. But at least OG4C3 antigen is must. AD12 भी होता है, but OG4C3 antigen for filaria you should be knowing. What is the treatment? It is going to be DEC, diethylcarbamazine, but of course there are combinations of DEC with albendazole, DEC with ivermectin also that you've read in pharmacology. This was all about Wuchereria bancrofti. How will I differentiate Wuchereria bancrofti from Brugia malai? Because I know that Brugia malai, if you remember, man, this was coming via Mansonia and monkey. This was coming via the Mansonia plant and monkey. And how is it different from Wuchereria bancrofti? You will say, ma'am, usme bhi elephantiasis, isme bhi elephantiasis. Yes, but isme the difference is that the leg below the knee is involved. So if I draw one person over here, if I just not draw the full person and if I just draw his feet, we will realize that in Wuchereria bancrofti, what was happening was one limb is for Wuchereria bancrofti, one is going to be for Brugia malai. Okay? So this is how we will write. One is going to be for Wuchereria bancrofti, one is Brugia malai. So Wuchereria bancrofti mein I saw the entire foot was affected, and also guys the genitals were affected. How? Hydrocele was also going to be there. Brugia malai mein kya hai? There is only a below knee involvement that you will see. So knee ke niche genitals to nahi hota. So there is a below knee involvement is in there, and there is no genital involvement. So there will be no hydrocele. Only this much area is infected. Wuchereria mein the full limb is going to show that big elephantiasis, and even the genitals are going to be affected. Coming to the next one, there is something called Oncocerca volvulus. I just told you Oncocerca volvulus is going to be something that will be transmitted by the black flies, and at the same time I told you it is going to result in the black skin. And here you have, what is it known? known as? It is known as the leopard skin. But other than that, what else can it cause? तो मैम ये दिख रहा है यहाँ पर, I can see pigmentation and skin involvement in the form of dermatitis, thick and pigmented skin. But at the same time, there are lymph nodes also here which can get enlarged, known as hanging groin, and it can involve the eyes, that is river blindness. तो ये fancy नाम याद रख लो. Leopard skin, river blindness, hanging groin, these are all features of Onchocerca volvulus. There is a very famous skin test, fancy name again, Mazotti skin test, which is basically done for it. Drug of choice for here, we prefer ivermectin also. So fancy names for Onchocerca क्या क्या है? Leopard skin, hanging groin, river blindness, Mazotti skin test. One last fancy name is left, and that is going to be for Loa Loa. Everyone has heard of a song called Mr. Loa Loa, right? So Mr. Loa Loa is a funny song that is being played in a bar called Kala Bar, right? So remember, Mr. Loa Loa is a funny song which is being played in a bar, and the name of that bar is Kala Bar. So what is Kala Bar of fugitive swelling? Kala Bar or fugitive swelling, number one, it is seen with Loa Loa, and it is basically a hypersensitivity reaction of the adult worms. The adult worms are resulting in it, and uski wajah se kya hoga? There is going to be itching, fever, swelling. These are the kind of things that you will see. The treatment, again, like all the filarial worms, is going to be DEC, diethyl carbamazine. So that is Mr. Loa Loa, funny song, fugitive, in Kala Bar swelling. Coming to the last one, I end the parasitology section by telling you the three most important, the mnemonics that you need to know. Which are the eggs which are bile non-stained? Non-stained matlab they're not going to take the color. So Neha is non-stained. What is Neha? Pehle pick up the hookworms, Nectar americanus, Ankylostoma. Hookworms ho gaye. Then you have Enterobius. Remember, it had that D-shape egg and that chota wala cystode H. nana. So remember the hookworms, then Enterobius and H. nana, they are non-bile stained. Neha is non-bile stained. Which are the ones which can cause infection from self to self? Auto-infection. There is chest, and chest actually has a double C also. So pehle to let me tell you what is the single C which you need to know. Cryptosporidium, right? H. nana, Enterobius can cause strongyloids and Taenia solium. Even Capillaria philippinensis can also cause auto-infection. So if you want to learn it, yes, Capillaria philippine, because of Philippines mein hota hai. If you remember, we had done it in our main videos. Which are the ones which do not float? I'm not telling you the ones which float on saturated salt solutions. The ones that do not float, ulta pad rahe hain. To ulta pad rahe ho to ma'am, to ulta mnemonic. The ones which do not float are ulta or ulta. So unfertilized eggs of Ascaris. Remember I told you Ascaris had fertilized and unfertilized. Fertilized used to float, unfertilized did not float. Then we have the larva of strongyloids that we had seen, the Taenia eggs and the operculated eggs of trematodes. I hope you remember the operculated eggs were the ones with the lid. So remember, unfertilized eggs of Ascaris, larva of strongyloids, Taenia egg and operculated eggs of trematodes. These are the ulta mnemonic, which ulta do not float on saturated salt solution. And yes, on that note, we have finished off our entire rapid review of parasitology segment, starting from amoeba, free-living amoeba, going on to the coccidian parasites, then the hematozoa, sporozoa, trematode, cystode, nematode. Quite a journey, very, very important for the exam. Sum this up with the snapshot videos and you are, trust me, good to go for the exam.